Hello, hello. So welcome, and I hope you enjoy. I decided to choose chronic obstructive pulmonary disease, or COPD, as a part of my research project, because I'm going to school for nursing, and as part of a case study that I did for one of my classes, we had to review case notes of a patient, and the diagnosis ended up being a COPD, specifically emphysema. So I always took a special interest from that, especially because I possibly want to go into respiratory nursing as well. Um, so, COPD, or chronic obstructive pulmonary disorder, or it's also known as chronic inflammatory airway disease, is more classified as a umbrella of diseases for the respiratory system in the human body. Um, and in this case, there's many different aspects of the respiratory system that make the lungs work the way they are supposed to on a normal day-to-day basis. And some of the diseases that affect the the system, they affect different parts of it. So, for example, for asthma, you may know someone who has asthma and they have an inhaler, and they use that to help them breathe better because there's certain parts of the body called bronchioles. And those bronchioles in someone who has asthma, they can constrict and basically restrict the airway of, or the pathway for air to get into the lungs and to fill them up. They struggle with that. Whereas someone with chronic bronchitis or emphysema, they struggle with a lot of inflammation, either from a lot of infections, where you might get that from bronchitis, or inflammations for emphysema patients who typically get that because they have a smoking habit. Um, but we can explain how that affects it later. Okay, so with the idea of COPD and emphysema in mind, uh, in my research to find a question to properly ask, I saw that a lot of people in the US live their lives either unknowingly having it or having COPD in some sort of way. So, what lifestyle choices in the US are we doing that are different from other countries, and how that might affect us is something that became a particular interest of mine. So, a lot of common symptoms of people who have COPD have like coughing, wheezing, excess phlegm, mucus, or sputum, and that's basically like the fluid that builds up in your lungs, the shortness of breath, and there's trouble with deep breaths. And the symptoms that proliferate because of these diseases, they are there for a reason. So, the coughing and the wheezing, it's a reflex of the body to try and cough and try and get whatever's obstructing the airway out. So, like if someone's choking, they try to cough, and that's actually a good sign. So, if someone's coughing while they're choking, you don't touch them. The phlegm and mucus and sputum, that's like trying to cover the airway and give it a little bit of extra protection, even though the extra protection can actually make it worse and can induce the coughing and wheezing because it's actually making the airway worse rather than better. Shortness of breath or trouble taking deep breaths, especially when it comes to like emphysema patients and everything. Um, if there's fluid buildup in the lungs, which you typically find in emphysema patients, um, the fluid is blocking what are the functional tissues called alveoli, where it passes CO2 and O2 through these really thin membranes so that it gets to the blood. However, if there's fluid blocking the alveoli, then O2 can't pass into the blood, and also at the same time, it's blocking space for the air to go into the lungs, so it means more shallower breaths. So you can't take a really healthy, deep breath and you feel more like you're like constantly having to take shallow breaths just to try and get some air into your blood. So, in some cases, the body tries to self-correct itself, and in this case, some immunity cells, white blood cells specifically, called neutrophils, they go to areas where there's inflammation in the body. And mind you, emphysema patients, they have constant inflammation in their lungs because of smoking. And the body tries to be like, oh, there is possibly a bacterial infection going on. Let's go to this area and try to see what's going on. However, neutrophils can make it worse through dysregulation. So instead of aiding the inflammation and possibly phagocytizing any possible bacteria that's there, they end up exacerbating the inflammation and just it turns into like a rolling stone downhill. Um, it doesn't actually end up helping, it just makes the situation entirely worse. So, at the same time, emphysema patients and everything, people who smoke tend to have the most risk for contracting COPD because, again, inflammation and everything, and even people who work in areas that have a lot of like secondhand smoke or dirty air, they also have to worry about this particular issue. And lastly, for people who have this, not only just trying to prevent it in the first place, but for the people who unfortunately already have this issue, asthmatics, they have the inhalers and they're called bronchodilators, but then people who have like emphysema or chronic bronchitis, they might be diagnosed glucocorticoids or corticosteroids to help aid in their healing process. If I remember correctly, there's no necessary cure other than, just trying to not make it any worse than it already is, but then at the same time, just trying to live like a healthier, active life, trying to lower their blood pressure, that kind of thing. It can always help relieve some of the symptoms of COPD. Thank you so much, and I hope you have a nice day.